Thank you. Did you have another comment, Dr. Montgomery? You seem
No,
like
I'm just sorry to take over the question, but
no, no,
thought of it. This is
you
great
did a
stuff.
great job asking a question. So I'm going to actually have the audience ask a couple of questions here. So excuse me, Mary Chu or Mary C, if you could go ahead and state where you're from and ask your question. And let me just see if I can. Oh, can you unmute yourself, Mary? If not, I'm going to move on because I can't unmute you for some reason. Okay, so next audience member, David R. David, state where you're from and ask your question.
Hi, this is David from Massachusetts. I actually have two quick questions. First of all, when you spoke about statin, I was wondering what are your thoughts about red yeast rice as a substitute to statin, especially in the meaning of reducing LDL particle levels that out of the threshold. And the second question is mainly to Dr. Bryan. You mentioned about the mouthwash that can disturb the production of nitric oxide. Do you know if ionic toothbrush can also be disturbing the nitric oxide production, or it's safe to use? Thank you.
Dr. Montgomery, you want to tackle the red yeast rice?
Yeah, so we have used red yeast rice. I mean, it's a natural statin in certain situations. But again, I don't make a big effort to use that. For instance, individuals that may have lipid imbalances, we may use bergamot extracts. But we do have a supplement that has a red yeast rice. We do use it sparingly. So, you know, the pharmacology of the molecule from statins come from red yeast rice. In theory, it's supposed to be more natural, but anything in a supplement form is not as natural as it in the natural food. So if you have a red yeast rice that's in nature from a food source, it's probably better than if I gave it to you in a capsule. But we make an emphasis on using dietary and lifestyle as an approach to reducing cholesterol more so than using any kind of supplementation because we allow the body to reach biochemical and physiological balance. And wherever the cholesterol lands there is likely to be the ideal cholesterol based on what that body's biochemistry is, the person's biochemistry is.
Yeah, I would agree with that. Yeah, and then addressing the bacterial issue. So we've done a really full characterization of these nitrate reducing bacteria. So just to be clear, these are the bacteria that we're fully characterizing that are responsible for nitrate reduction to nitric oxide are on the dorsal part of the tongue. So on the back part of the tongue near the gag reflex, and these are facultative anaerobes. So what that means is when there's oxygen around, they can utilize oxygen. In an anaerobic environment, then they start utilizing nitrogen as an energy source, and they perform this 2-electron reduction of nitrate to nitrite. So anything that gets in the crypts of the tongue and kills the bacteria is damaging. Chlorhexidine, alcohol-based mouthwash, fluoride, toothpaste. So the toothbrush isn't really going to affect it. It's really the chemicals that you're using with the toothbrush. You know, for instance, I use an electric toothbrush, I use a non-fluorinated toothpaste, and I don't use a mouth rinse. And because what we're finding is if you can maintain a healthy, diverse microbiome, what we find, we published on this in 2014 and again in 2019, the more diverse the oral microbiome, the healthier the microbiome. And so anything that destroys the diversity of the microbiome completely shuts down nitric oxide production. So we've still got a lot of work to do in this area. There's probably more that we don't know than what we do know, but what we do know is that anything antiseptic that indiscriminately kills the bacteria in the mouth is bad. Fluoride is bad, mouthwash is bad.
So Dr. Michael Greger did a video on tongue scraping versus brushing the tongue with a toothbrush. And in the video, he was saying how the tongue scraping actually had a greater effect on greater diversity of bacteria in the mouth. Are you aware of anything like that?
Yeah, in fact, we published on that in 2019. I think his video was in response to our publication.
Okay.
And what we found was, and this was in relation to try to figure out what effect does chlorhexidine have on blood pressure. And in this study, we did it in collaboration with the dental school at UT in Houston at the medical center. And we enrolled mainly dental students and dental hygienist students who, as you may imagine, are obsessive compulsive about their oral health. And what we found was that there was a cohort, and we didn't find this until we queried the subjects, but about 20% of these patients were using a tongue scraper. And what we found was the people that were using tongue scraping not only had better blood pressure management, they had a more diverse oral microbiome. But the interesting thing was that when the tongue scrapers, when they used the chlorhexidine, they saw the biggest increase in blood pressure. So I think what's happening, so to answer your question, tongue scraping is good, but tongue scraping and then using a mouthwash, we had one patient, his blood pressure, systolic blood pressure went up 26 millimeters of mercury after 7 days of using mouthwash while he was tongue scraping. So this was a 21-year-old triathlete, plant-based diet. We made him clinically hypertensive in 7 days just by giving him mouthwash while tongue scraping.
Okay. So, all right. So then tongue scraping is great, but then if you follow it up with mouthwash,
Yeah, you're gonna see a precipitous increase in blood
it's gonna
pressure.
have an actual like adverse effect, as if you hadn't done it would have been better if you didn't do the tongue scraping to start off with before you took the mouthwash.
That's exactly right. And what's happening is kind of like tilling the soil, right? So you're opening up those crypts, and now you're basically improving the accessibility of the chlorhexidine into the crypts of the tongue and completely eradicating the microbiome.
All right. I'm ordering a tongue scraper tonight, so I appreciate it. All right. So the next question is from Ali D or Ali D.
Yeah.
Stay with mom and ask your question.
Yes, I have two things. My total cholesterol is 150. My triglycerides are 79. I live in Southern California. I'm out every day gardening, and I take no medications. So I don't understand why it's so low. But the one thing I am concerned about is my vitamin D has been critical for years, from 7 to 16. I take 2 prescriptions a week, 50,000 each. So that's 100,000 international units of vitamin D. And I take 5,000 a day over the counter. So that's 135,000 international units. So obviously, with me being in Southern California, it's not from being out in the sun. It's got to be some absorption problems. So what else can I do? I mean, I think 135,000 international units is crazy. And so does the pharmacist thinks that too, why I'm not absorbing it.
Well, I think if you're taking that much vitamin D, you certainly have to counter that with some K2, some vitamin K2, so you don't mobilize calcium from your bones, and you got to support normal calcium flux, because vitamin D certainly has an effect on calcium. But if you're not taking
but it's so low. But it's so low. It's 7 to 16. It never goes up with all that prescription. My levels do not go up.
What are you putting on your skin?
Nothing. I never use any kind of no kind of sun protection, nothing. And I'm out in the sun. I live in Southern California. I'm out doing gardening every day.
And the kind of soaps you use? What do you shower? What kind of soaps do you use?
Ivory.
Ivory? Yeah, I would look at the soap. Some naturalists will say, and we're kind of getting a little bit of the weeds here, but oftentimes people are recommended not to shower every day. That's number one. Number two, you shower, you want to just wash under the armpits and private parts and not your whole body. So, because you could be, I mean, let's say you're in the sun every day, you shower every day with your ivory soap, you're washing away the beneficial effects of the sun and vitamin D production on the skin. So you want to, and again, if you're out going to a party or an event, that's one thing. But let's say in a weekend, you're home all the time, you may not shower the whole weekend. Right. Depending on who you're around, and I would get away from the ivory soap. The natural soaps, some people argue just sort of let the water from the shower rinse you and cleanse you, but the ivory soap may be a contributing factor, and it's oftentimes some of the small things that will contribute to the clinical events. Because if you're in the sun a lot, you should be absorbing it. Now, of course, let's talk about what they're spraying in the air, et cetera, et cetera. You can also get a UV light that helps you get some of the healthy ultraviolet rays to your skin. So you can use that as an adjunct to the sunshine. So I would say get rid of the IV soap, reduce the frequency of soap showers. Maybe you can shower with just water. And when you do use soap, use something that doesn't have, nothing more than a few cleansing oils and just wash the armpits and private parts and not the large skin areas where you're using for vitamin D conversion from the sun.
Yeah,
What
the
is
other thing
natural
I
soap?
would,
What do you mean by a natural soap?
Well, I get mine made from a local person here. It just has a few oils in it, and if I had it in front of me, I can list the ingredients. But you could probably get some natural soaps that just doesn't have a lot of the chemical toxins that block your glands and the like, and so on.
yeah, I would recommend for the vitamin D levels. Vitamin D is not really orally available, especially if it's in tablet form, and especially if you're achlorhydric. So I've taken some liquid vitamin Ds that you put and hold it under your tongue for 30 or 60 seconds, let it be buccally absorbed, and then swallow it. And I found that you can actually increase your blood levels of vitamin D much more effectively with a liquid vitamin D product rather than a pill or capsule you're swallowing.
Yeah,
And
we
one
use
oth-
vitamin D. I agree with that.
and one other thing, can you explain why my total cholesterol is only 150? My triglycerides are 79, and I don't take any drugs.
Well, that's where your body lives. Again, it's,
Sure.
it isn't so much a number per se. Your body, knows what your total cholesterol needs based on its biochemical physiological needs. Somebody that may be predisposed to neurological damage, or maybe somebody, let's say you have an athlete who had head injury or whatever, or somebody's had head injury, they got a lot of neurological injury and repair, maybe that cholesterol needs to be higher. And so it all depends on what's going on with your biochemistry and physiology. So your body may not need to have more cholesterol than 150. So that's why we talk about, evaluating and treating the patient and not the number.
Great,
I
thank you.
completely agree.
And so our next audience question, we've got about 4 minutes to wrap everything up. So it seems like we're gonna the one more question will fill up the time. So we'll take this one more question. Cheryl L, if you can ask your question and state where you're from.
I'm from Santa Rosa, California, and my question is about the Framingham study, because my understanding has been that over several decades that no one with a cholesterol under 150 ever had a heart attack or other cardiovascular incident. And so is my understanding of that incorrect? And if it's correct, how do you reconcile that with people living longer, having a cholesterol over 200, if it's still true that cardiovascular disease is the #1 killer of people?
Thank you.
Well, the problem, kind of the blessing and the curse of the Framingham study is it's an enormous data set. And so again, when you're looking at published data, it's the interpretation of a specific data set and whatever endpoint they're looking at. So you can look at events and they're looking at one number and how that correlates with an event. So it's an association. If you look at longevity and just, whether or not they have an event or not, or diabetes is just the day they expire. That's a completely different data set than looking at the number of events that occur and looking at, the numbers related to that particular data set in that study. So I think you can, and here's the problem, in the medical literature, you can find whatever you're looking for, right? And so Dr. Montgomery will probably know that as a cardiologist. I never argue with the data. The problem comes with the interpretation of the data. And that's where a lot of physicians and even a lot of scientists get it wrong. The data are the data, they're just a misinterpretation of it.
Right. And your thoughts on that, Dr. Montgomery?
Yeah, I agree with that. And the thing is that in terms of reconciling it, again, you have to go back to the context. So, if you look at elevate cholesterol in terms of, causing cardiovascular events, the cardiovascular events are, let's take something like obesity and say, okay, well, gosh, obesity is associated with diabetes, heart disease, and all of these other illnesses. And say, okay, is it obesity that's causing the problem? Well, obesity may be a sign or it may be a sign of an underlying problem and not necessarily the problem itself. So obesity is associated with all these problems, but it isn't just obesity by itself causing the problems. So if somebody has elevated cholesterol, for example, you may have elevated cholesterol for any one of a number of reasons. I gave one, alluded to one, maybe you have some brain injury or neurological issues the body needs to repair. But there may be other things. I mean, in the China study, Colin Campbell saw an association with elevated cholesterol and cancer. And so, again, you have an underlying biological process of injury repair that predispose the liver to make increased cholesterol. And the increase of the cholesterol may be it may be a response to a needed response, I should say, to an underlying adverse effect. So, for example, look at obesity or fat formation. Somebody gets a lot of fatty tissue inside cells and tissues. You say, okay, you have fatty liver. Is it the fat in the liver that's causing the problem? Not necessarily. It's the toxic effect of the liver. And so fat cells may be made to store reactive oxygen species and toxic chemicals that keep them away from the hepatocytes. So the fat could be a response to an underlying biological process that's abnormal. We may treat the fat. The cholesterol may be a biochemical response to an abnormal biochemical process, not the problem itself. And so when you look at elevated cholesterol in different contexts, that's what brings about the confusion, because it's going to be associated with bad things happening. But in and of itself may not be the bad thing that's the problem. So we shouldn't target lowering the cholesterol. We should target the problem that's causing the cholesterol to be up. And so if someone nourishes the body naturally and gets rid of the underlying problem, the cholesterol comes down naturally, because the reason cholesterol is up is not because you're eating too much cholesterol necessarily. The reason cholesterol is up is because there's an underlying problem that the body's responding to physiologically and biochemically to, and you need to address the problem. It's like when your fire alarm goes off in the house. You don't just get up and turn off the fire alarm. Okay, to get rid of the noise, but then get rid of the fire. You gotta get rid of the fire. And so we're not getting rid of the fire. We're just turning off the fire alarm.
Yeah. Now, I would agree with that. Like, your body regulates everything it needs. If your body needs more cholesterol, then the HMG-CoA enzyme is going to make more cholesterol for your body. If it doesn't need it, then it's not going to make it. If you're getting, it's a balance. You get what you balance what you eat from your diet versus what your body naturally produces. So the body's a lot smarter than any doctor or any drug out there. We just got to get out of the way. Let the body do its job.
Thank you. And that concludes our panel. If you would really quickly, I'll throw it to you, Dr. Bryan. How can people follow you and get in touch with you?
I send people to my educational website, drnathansbryan.com. I've got videos on there. I do a monthly blog. You can find me on social media, Dr. Nathan S. Bryan. I have my own YouTube channel where I'll post, interviews, podcasts, blogs, and really my objective is to educate and inform on the importance of nitric oxide so consumers can make, informed decisions on what they can do to, lifestyle changes, dietary changes they can make to improve their nitric oxide production. And if you want to reach out to me, my email is drnathanbryan@gmail.com. I'd be happy to answer questions.
Great, thank you. And Dr. Montgomery?
Yes, you can go to my website, montgomeryheart.com. It gives you an overview of our Heart Center. There, if you go to like the Getting Started, different programs, you can email us at support@montgomeryheart.com. And it tells you all about what we do. And you can also, through the email, request an appointment or ask questions or the like. We have an online community that we engage. People are part of our community. We have online coaching programs. And we have a YouTube channel at Montgomery Heart Wellness on YouTube. And we talk about the different approaches that we take. And we actually give you insight in terms of our clinical practice. So I work with my PA, and we will explain different patients and how we utilize nutrition. We get to some of the specifics in terms of exactly how we do that. In talks like this, we talk a lot of theory. In that setting, we give you specifics in terms of step-by-step approaches that we take. How do we use nitric? How do we use some of the regenerative therapies and how we integrate that with other things. So.
Great.
Yeah, and Michael, if I may, if those of you interested in our drug program and want to keep up with our FDA trials, it's bryantherapeutics.com, and our consumer products are n101.com. It's the letter N, the number 1, the letter O, number 1.com.
Great. Thank you so much, gentlemen. And if we could unmute the audience so they can say thank you.
Early and I don't wake up.
Thank you.
Thank you very much.
So much.
Great.
Appreciate it.
Thank you. I just